Hello, everybody, and welcome back to ARPneuro Therapy. This is our Q&A. My name is Jake. I am your trainer, and with us, as always, is Matt, and he is now Chance Dell, coming from Chicago, rapping with you, and hopefully he'll be able to share a nice rap with us today. Matt, good to see you.
Yeah, no raps coming your way, but we do have a special guest from Chicago area, so I had to go with Chance as the rapper, probably the only rapper I know from Chicago, but it's going to be an exciting guest. I can't wait to hear his story and find out a little bit about his practice and how he's integrated ARPneuro into his clinic. So
yeah,
really excited about that.
It is about time he is on this show.
How about it? Yeah. I think he's been using the technology for what, 13 plus years?
Yeah, I think it's been close to that, long before we even had this. So
good stuff. Well, maybe we could jump in and kind of give everybody the traditional overview. If you have not heard of ARPneuro, I wanted to just give you a very quick overview. There is so much information on our website. I'll kind of fly through this today, but feel free to go to any of the videos and questions and all the information we have on the website. But ARPneuro, the technology that we're going to be talking about today, has been around for over 20 years. Huge success rate, helping clients with all kinds of different conditions, some of which we'll talk about today. The primary focus of the technology was around professional athletes, sporting teams, and really the focus has been, recovery, range of motion, and really increase, the recovery rates for any injury or preventive of injuries as well. So you can go to the next slide.
You got it.
So like I said, this thing has been around the professional sporting arena for the past 20 plus years. So that's probably, if you've heard of it, it's in that arena when you've watched one of your favorite athletes recover from a major injury and get back on the field quicker than traditional therapy.
As your rank goes up in pickleball, I am still waiting for that pickleball logo to be on there when you touch a lot of people.
Well, what's amazing is I'm sure we're going to get the pickleball on there. I mean, it's they've got professional leagues now, and it's amazing to watch. But it is the fastest growing sport without question in the U.S.
That's so funny. Excellent.
Yeah, I mean, personally, this is my personal experience with it. This is my youngest son. His senior year, broke his leg, fourth game of the season, late September. And all the doctors, everyone said there's no way he's basically coming back for basketball. He went in, did 20 treatments of the RX, the ARPneuro with the RX, and he came back. That's him actually playing not only on senior night, but played in the last 5 games of the season, which kind of blew away his the doctors, coaches, everybody, and that led to a lot of players, taking up the ARPneuro treatment to recover from any injuries, so they could continue to play during their high school career. Without being able to put weight bearing, he had a rod between his knee and his ankle, and he was able to work the muscle, so there was no issues when he actually strengthened the bone, so he could actually play and be able to move much better than if he would have just sat and did the traditional Rice method. So,
Matt, forgive me if I've ever asked you this, but since I'm kind of going over the post-surgical protocol, did he actually do that with the background and running blood flow? Did he do a post-surgical, or did he go right into the therapy portion of it?
So he rested probably, whatever the traditional 2 weeks before he started therapy. And then, he started doing the therapy. And as he went back to the doctor, they were kind of blown away by how quickly he was recovering and his bones were healing. And so I wish we would have had the PRS at the time, so he could have done the main pulse suspend and, taken advantage of that at home, but we did not. So, but yes, it was, that's basically how they did it. So
nice.
Yeah, one thing, if you haven't heard about it, again, Logan University in St. Louis, they've spent 2 years doing kind of a whole due diligence into the technology. They were so blown away by the outcomes. They now have added this to their curriculum. We have a clinic. They have a clinic in where they're treating specifically with the ARPneuro. So you'll start seeing this more and more. We've got about, I believe, 81 clinics now that we've signed up to treat with this technology across the country. all of which you can find on our website if you're looking for a clinic in your area. So really, there's two products. You got the RX100, which is the Class 2 medical device. We'll be talking about that at length today in today's conversation. And then the PRS is the exact same technology. It's over the counter. And really, the only difference is the number of contractions. The RX100 can do 500 contractions per second, and the PRS can do 245 contractions per second. Great device. I mean, we are getting orders regularly from professional athletes, collegiate athletes, high school athletes for the PRS so that they can utilize that on the road during their training, really anywhere. So it's becoming, fast and furious getting those to weekend warriors and athletes all over the country.
Awesome. So
basically, Jake, if you want to take this one and talk a little bit more detail on the neurological origin of how this works, that would be great.
Absolutely. And again, everyone always thinking about TENS unit or any type of other electrical stim that's out there, that you can find on Amazon. You're going to find that 99.9% of that is going to be on alternating current. So that takes away from the neurological aspect. It's going to be more physiological. With ours, we are contracting the muscle the same way your brain does it, except at 500 times per second or 245 times per second. So that's the reason why this list gets so extensive, because we have a broader range of things that we can do with it, as a result of that direct current. So one of those certainly is alleviating pain, but a lot of that pain is alleviated because it's not a pain blocker. We are actually fixing that issue. We're contracting muscles around that area. We're firing muscles that before that were dormant, and we're getting blood flow into that area. So the one of the things I do like to always focus on is that increasing the range of motion. A big separator between us and any type of direct current isn't just the way the current runs, it's how it operates. So with alternating current, that's going to go to your brain as being a foreign wave. So when you go through that eccentric motion, or you're opening up into that motion, it's very hard to keep that position. And a lot of times it restricts you from going into a full motion. For us, we could actually get into that eccentric motion and actually increase that range. So we do have that ability, during, but also after that treatment, where you start to see, wow, my range of motion is better than, it's been in years. I've seen people who haven't been able to touch their toes for 10 years. They go through a few treatments, and before you know it, they're touching the floor. So pretty common results with that, and definitely a separator between us and any type of alternating current that's out there. And again, kind of going into, essentially what we are, just accelerated recovery, increasing performance, and of course, strengthening the muscles. It does that very well, even though it's a byproduct of what we do. But that accelerated recovery, that's our bread and butter. That's what we truly focus on. That's where we're getting a lot of the results. We're getting athletes back to their sport a lot faster, and we're getting people back into their regular lives and recovering faster after surgeries or injuries. And the major reason, again, going into that is because of that certain wave that we have with direct current that is a lot like the brain. And now the wonderful thing about this is Dr. Battaglia is going to talk about some pretty unique conditions. And while they're rare, the fact that this is able to have some results with that, I'm very excited to hear his results and what he has to say about it. But a lot of the things that you see on here aren't very rare. There's people with chronic pain. There's people with core weakness. You can see as you look down the list, I mean, it's just, it extends so rapid, so broad. Neuropathy is a big one as well. We've worked with hundreds of patients, if not thousands, with neuropathy. We even have doctors that are podiatrists that use it specifically for that foot bath modality and get a lot of great results. So on top of just your shoulders, your ankles, your knees, kind of your basic, you can see we work with a lot of other kind of complicated cases.
Yeah, and if there's anything on there that anybody has questions about or wants more information, please don't hesitate to email us at info@arpneuro.com. And we'd love to, if there's something of specific, we'd love to, do a Q&A on that topic or get you information on any of those conditions.
Absolutely. Thank you for that, Matt. And also we do have the questionnaire here. So if you have any questions now while we're going, you could go into the chat and feel free to leave a question as well. And this comparison, we've already did it, but one of the things I always like to spotlight is the contraction compared to the increase in blood flow. So again, you're not going to find, even on the high end TENS units, you're not going to find anything that goes much higher than 10 contractions per second. Most of them are probably less than that. With ours, this is our take home unit. That's 245 times per second. And of course, the clinical unit goes at 500 times per second. So you can basically go even further with these numbers when it comes to increase in blood flow. But certainly the ARPneuro PRS compared to the TENS unit is 25 times more blood flow than what you can get from a TENS unit. Matt, this is your deal, all about the outcomes.
It's interesting, as we met with the team at Logan University, one of the things that they said was as they kind of dove in and really did their due diligence around the technology, they were blown away by the outcomes. And, so that's kind of been our tagline, if you will. It's all about the outcomes. So if you've got any ankle or back or foot or hip or knee issues, we'd love for you to kind of, learn more about it and hear your story on, the outcomes. So, it is all about the outcomes and the success of those outcomes for sure.
Thanks. And a question just did come up from John Brown. Thank you for this question. It's a good one. We've gotten it before. Comparison to the new fit. That's probably the best comparison you can do because it's essentially our technology in their box. It is a little different because it's the older version of our technology. So if you go into probably 10 years ago, that's probably what we're looking at. But it does a very similar contraction, very similar blood flow. You can get into similar modalities. The functionality of it's a little different because you have to use a plug. But as far as the guts of it, that's kind of like our engine in their body. So I hope that kind of answers your question. Probably an older version of that, though. Getting into the modality, not a lot to talk about this, but this, if you have been watching our YouTube channel, we have a lot of these protocols, kind of going over the PRS and the placements with the PRS, but you can literally replicate those protocols that I show there with the RX. As you can see, this is kind of an RX protocol as well. This is post-surgery. And in this comparison, what I have here is a 2-lead and a 4-lead. On the left side is the 2-lead. The black is going above the incision and the red is going below. And essentially what you're doing is just running that blood flow. You're going to a background. And just a minute, I'm going to try something different where you can actually see one of the things about the PRS compared to the RX. It's a little clunkier to get to background on the RX. So I want to visually show you rather than just giving you some slides. But you'll have to bear with me on some of the technical issues as well as I'm gonna creep up my desk for a second. We're gonna change some video. But as you can see on the second slide, there's 4 pads. So you can use the 2-lead or essentially the 4-lead, to get more blood flow. And give me a second here. I'm going to add this to the stream. Let me drop this down a little bit. So if you can see the RX here, I'm going to pull this slide off. And I'm going to make this bigger. I hope you can see that. So it's very common that people struggle with this one. So I actually wanted to show you. So where you see this duty cycle at CONT, that's going to be the default essentially. So it's just going to be a continuous cycle. That's what we usually treat on. Oftentimes that's what I recommend. But when it comes to background, you want to push that default here. So we're going to click on that. Now the duty cycle says 1-0. We want to come up here. We want to hit that top minus button. If my fat fingers can do it. There we go. So as you can see here, you want it to read 0-1. And now if you look back down here, it reads BKGD. That essentially just means we shut that top current off and now we are on background mode. So when we start this, what I want to do is I would hit the start button, and assuming that I had these pads placed on a patient, I would just hit the knob and I would want to increase this all the way up to 100. Now, there are some things with this. Now, chances are they're probably not going to feel this. However, when it's post-surgical, sometimes you will feel some sensation even on background, because there's still a current there. It's just not contracting like you would from the full main pulse that you would get. So you want to turn you essentially want to turn this output power as high as you can go without the patient feeling it. Now, this is basically explaining the post-surgical protocol. We're saying almost immediately after the surgery. And this would be a case where you would just run this blood flow for a 20-minute period. So I hope that makes a little bit more sense. I'm gonna remove this now, and we'll go back into this slide here. Oops, wrong one. Okay, so the last thing I want to talk about here is so if we're being aggressive, as you can see there, after 48 hours, you would go into some sort of muscle contraction. But for the most part, typically it would be about 2 weeks of running background, or we consider blood flow. And as you can see at home, the at-home device is often the PRS. But in most cases, if you're in the office, you can always run the RX, which you're going to get a little bit more power, perhaps a lot more power to. So that would be the unit that we would suggest. And this makes it a lot easier as well to be able to kind of go through. You lay there, and for the entire session, you would just run that background. So if you guys have any questions regarding the post-surgery, feel free to reach out to us. As Matt said, it's info@arpneuro.com. Also in the comment section right now, you can certainly ask us a question live. Even if it's not pertaining to this, feel free to do so. Now's a good time. That's why we have these Q&As. And without further ado.
Well, Jake, I would like to, make a point on that. It's interesting, as I've been traveling around the country talking to some of our clinics, utilizing the ARPneuro RX. It's interesting. There was one particular clinic that I talked with, and they take on a lot of the pro athletes that come out of surgeries from a renowned doctor in the New York area. And when these patients and pro athletes are in this particular area or in this clinic, this particular doctor is only going to, send his clients, these pro athletes, to one of the clinics that has the ARPneuro treatment for faster recovery. So it's interesting that you're doing, post-surgical, protocols today, because it was interesting to hear that this particular clinic is getting a ton of pro athletes after surgery for that specific reason. So I wanted to get your take on that. And obviously it's probably for the speed of recovery, which will make the surgeon look even better, I'm assuming, correct?
100%. They look like rock stars, right? It's one of the reasons we have had recently a lot of orthopedic surgeons jump on board because of this particular protocol. We're not saying, we're not trying to take away the surgery if they think it's necessary, but what it does is it helps that surgery recover a lot faster. Like you said, the athlete gets right back to their sport quicker. And who do they look to? They look to the person who actually did the surgery. So they look like rock stars, and whoever was working on them during that point, they also look like rock stars. So it's a win-win. Everybody is a winner at this point, and it's one of the reasons we really love this protocol. So that's a good point.
Sounds good.
Is it the one in New York City, or are you talking about the one in Miami, Matt?
Yeah, there's a whole slew of them in the Florida area, and I'm trying to. I'll look up the name for it while you do the introduction.
I believe, and correct me if I'm wrong, I believe it's the USA Sports Medicine in Miami.
Yeah, USA Sports Medicine, and I think they have several locations across the Florida area. So they do a lot of work with professional athletes. So it is USA Sports for sure.
Yeah, it's so many athletes that go through there, but yeah, it's awesome stuff. Thanks for bringing that up. And yeah, thanks for your questions, John. All right, without further ado, let's get into the real reason we're here. And I'm excited to have him, because I will say a lot of what I have learned over the years, I can basically tilt my hat to this guy. He has truly been the one who's taught me probably the most when it comes to the RX, him and Dr. Brian. But he's a dedicated chiropractor. He's a visionary entrepreneur as well. He was born and raised in the Chicagoland area. And his journey from hockey, basically a hockey scholarship recipient at the University of Arizona, to becoming the owner and practitioner at ARPneuro Therapy and Chiropractic in Bloomingdale, Illinois. It's inspiring. His passion for helping people find effective, expedient healing led him to a transition from sports to science, also earning degrees in exercise and sports and science, human biology, and ultimately achieving his Doctor of Chiropractic degree. As a founder and partner of ARPneuro, Dr. Battaglia continues to revolutionize the field, blending his firsthand experience with cutting-edge therapies to provide innovative solutions for better health and well-being. And now we get a chance to basically tune in to see the insights of his remarkable story and his transformative work that is making waves in the world of chiropractic. So everyone, please welcome Dr. Sam Battaglia. Dr. Sam, it's good to finally have you on here, and thank you for being here and taking your time, because we know how busy you are. So it's exciting to hear a little bit how efficient you work. I was recently in Chicago, and I'm tired from just watching you work.
Thanks for the introduction.
Yeah, would love to, Dr. Sam, would love to hear your story and how long just start from the beginning and how you got introduced to ARPneuro and how long ago was it?
Well, I started in practice in 2001, and a representative came in to show me what ARP and the RX100 could do.
Okay.
I had chronic tendonitis in my shoulder, biceps tendon, and working with team chiropractors and team PTs, working on that area. It would get better, but it just kept coming back. It would never go away. And going through the therapy with one of the reps, they determined that posterior delt and infraspinatus weren't firing properly. It's not something you can see in an MRI. It's not a test you can take to find that out. They just don't fire at the right velocity and time because of repetitive dislocations. So everything I did in the front of my body with hockey or working out loaded up the front of the shoulder. And that's what kept giving me that tendonitis. So once we introduced the RX100 through a scan, diagnosed that the posterior delt and the infraspinatus don't fire, turn those muscle groups back on again, puts my shoulder back in neutral, and then the biceps tendonitis goes away without ever even treating it. Once I saw that, then I said, we need this machine in here. Because as chiropractors, we're all doing the same thing. We all went to the same schools in the Chicagoland area. And this is something that would set me apart from everybody else. And that's what's happened. So I have people that travel from all over, even out of state, Indiana, Southern Illinois, Wisconsin, that come for this therapy because it's not readily available.
That's a great story. I noticed that when I did a Google search, I couldn't even find your office or anything about you, which tells me that, marketing is not a problem for you. Tell us a little bit about how you've had so many patients and so much success with the ARPneuro treatment.
Well, our first location is in downtown Chicago. And just a year and a half ago, we moved into a second location in the suburbs. And we've tried the marketing in the past 20 years ago. Nothing really works. It's all word of mouth. If you're not going to a dentist or a chiropractor based out of the yellow pages or online, you're going to have a referral. Mm-hmm. And at this new location now, it's predominantly what I do. I do 90% active therapies with the RX. I can't stop running. I've got patients that are coming in all day long. I'm probably going to hit my PR record again this week. And like this evening, it's just football players, basketball players, the hockey players are all coming in because they're trying to get that advantage, something that they've heard about, or they've been other places and they've kind of plateaued, and they've heard about what we can do about the speed of recovery, the speed of strengthening, and the way that we can scan the body and find out where we need to be as opposed to just guessing.
Okay.
Dr. Sam,
I'd love to hear. Go ahead, Jake.
Well, you mentioned, Dr. Sam, about you're about to set a new PR. I sort of alluded to it. Could you just speak very quickly about the busyness of your office and how you're kind of managing that, and what is going to be your new PR record?
Well, I have 4 rooms, and I've got a little area that we do foot baths and hand baths in, so they don't occupy a table in a room. and I can have 4 to 6 people going at the same time. I can just bounce in and out of the rooms. I've got one person doing anterior delt raises, the next person doing lunges, and the third room doing Supermans, and I can just manage them all at the same time, running in and out, making sure everyone's got good form, turning up the machines, doing 4 to 5 sets, and then having a little pocket area where I can have people running in foot baths for neuropathy and plantar fasciitis that aren't moving. And as far as like a PR record, 2 weeks ago, I hit 180 patients in a week. So I should beat that this week.
Wow.
Oh my goodness. That's crazy.
I'm surprised you're able to take the time to have a conversation with us today. So,
well, I did have to push it back 30 minutes because I wasn't ready.
It's all good. I'd love if you could share with us some of the success, some of the ones that come to mind. What's the first patient/success story that comes to mind that you can think of and share?
I'm in a new location. I've been here a year and a half. I guess a really good one is a young kid. He's in high school. He's a lacrosse and football player. During a lacrosse game, he had a complete tear in his ankle. He went to his first orthopedic. They said he needed surgery without ever coming here. His dad had been a patient of mine, so he came in. I took a look at him. Within a couple visits, we had him doing a lot of movements, lunges, Bosu balls. He went and I said, you should probably get a second opinion. He gets a second opinion. The second ortho said, I would not touch that with a 10-foot pole. Just keep doing what you're doing. Because of the videos that he showed him in terms of the injury, then the videos on his first visit that his dad took, and then 3 or 4 visits later, what he was able to do over a short amount of time. And looking at his MRI, he suggested that to do as much as you can without the surgery. I think this week was his second full week of football. No problems.
That's a great story. I guess I'm curious then, because as I've been traveling around and we've got 81 clinics and there's so many different chiropractic offices and PT offices, from your opinion, I mean, you've been around this technology now for 13 plus years. What is it and why is this not, prevalent with other chiropractors around the country, and what's the holdup, do you think?
There's really no clear-cut answer. I think, as you suggested in your intro, that a lot of it was predominantly used with pro athletes. Mm-hmm. In the beginning. They were just happy with that. One of the stories I could share is I had a baseball player. He had pitching pain in his scapular area. His dad's an ortho. They were working with him in PT. Wasn't getting better. She started doing some research and found ARP and baseball in some type of research, and she Googled me and found me. This was 5 or 6 years ago. Mm-hmm. Got working with him. Scapular pain was going away within a few visits with pitching because he wouldn't stop. And then the mom, because he was being driven in, he was a high school student. The mom said to me after a visit, she's like, I'm not telling anybody about you. You're my own little secret. So there is an advantage, I think, with the therapy, especially as you get older in college and pro, that I don't think people want that out there. They want to keep it for themselves.
Okay, that makes a lot of sense. I think you definitely see that in the professional ranks, and as we've started adding some of those stories of pro athletes utilizing the technology, you can tell that they're, after their career's over, they seem a little more vocal on what they did and how they treated their body. But I think that competitive nature of, getting a competitive edge is key. So that makes a lot of sense.
And they don't want injuries to be known, right? Mm-hmm. And they're using a machine at home or at one of their trainers or an office like this. They don't want to lose their spot. They don't want the other team to know that they're hurt. And there is an advantage to something that you could be doing at home to speed up recovery, speed up healing, and at the end of the day, moving into strength training with it.
So I'd love to hear from you, if you could just, tell us, what are some of the top 5 injuries that you see on a regular basis that you treat with the ARPneuro technology? And are there some typical common injuries that you tend to see a lot?
Anything that walks in my office that's an extremity: shoulder, knee, hip, ankle, wrist, elbow. They're going on this machine right away. With this therapy and the protocol, there's nothing like it. Traditional chiropractic can't touch it, in my opinion. If somebody's going to come in with lower back pain, you can kind of go either way. If somebody's used to a chiropractic visit where everything's passive heat, that type of thing, I can do that too. But what ends up happening is they plateau. Then I move them into the ARP wave and its protocols. But my favorite joint is the shoulder, because I've had the injuries. Somebody walks in here not knowing what we do and what ARP is, and they have a shoulder, elbow, knee, they're on the ARP right away.
Interesting. And in your opinion, tell me, how many sessions does it take to get a typical patient out of pain? How many sessions does it take for a patient to kind of start getting that mobility back? And then how many sessions does it take for that patient to be at full recovery?
We kind of use like an approximate 20 visit mark. Not everybody's inside of that. Sometimes you take more, depends on the injury, depends on if there's tears, more involved. But it's about 20. We use 10 to get you out of pain, 10 to prevent it from coming back through strengthening. But within the first visit, I mean, I can typically show somebody a 50% reduction in pain and a 50% improvement on your range of motion just in one visit. Now, that won't last, and it can, but that's why you need subsequent visits. We do scans, we do strengthening, we do ranges of motion to work on all that. But on a first visit, there's a wow factor. I'll get you most likely 90% of the time, a 50% improvement on your range of motion and a 50% improvement on your pain.
So how do you incorporate the PRS? Do you send patients home with that, or how do you incorporate that in your practice?
Well, I always explain it to you on the first visit that we have a portable unit that can complement what we're doing at home right here, right? Okay. And that machine assists on what I'm doing. So in regards to like my situation, we identified that my posterior delt and the infraspinatus aren't working properly, right? So there's atrophy there. So I can let that patient know we have a portable unit to then supplement what we're doing in the office. So I can have that patient hit those two muscle groups into our next visit. And then part two with our portable unit is that suspend, right? That background setting for blood flow. So having that machine above and below the tendinitis or front and back of the shoulder, so that there's current going through that shoulder joint to help speed up healing and recovery, because you've got blood coming to the area for the next 6 to 8 hours while you sleep. And we shut those contractions off so it doesn't disrupt your sleep pattern. Wrap the cords around the unit, put it in your pockets. You can roll around in bed. But now you're talking, if this patient's coming in 3 times a week, 30 minutes, that's 90 minutes in a week, right? You put a machine in their hands, you could be getting up to 18 hours a day of stimulus on the shoulder between blood flow and contractions.
Okay. It's great. I mean, I know I've heard, aren't you concerned that, they get this device and they no longer need your services, or how do that seems to be sometimes a traditional comment that I get.
Yeah, I can see that. But it doesn't happen that way. Okay. As long as you're telling the patient in patient education about the unit, this doesn't take over from what I do, right? Okay. I do a scan on you today. We identify weaknesses. We can then use the unit down the road to, work on other body parts, work on other family members. They'll understand that they need help with an injury in an office setting, that the machine's not going to take over. It just supplements what we're doing.
Gotcha. Yeah, I've heard from multiple people that end up buying the PRS for themselves. They quickly, after several weeks, will be calling for a second unit because their family members are stealing it and using it for, so it's amazing how, you can share that amongst family members, but once you get accustomed to it, whether you're trying to rehab a knee or whatever, you typically don't want to get that out of your possession. So
I think it actually generates patience, because you take this unit home, you have it on your shoulder, and then the family member is like, well, if we have it, my knee's been hurting me. And then you start to apply it to your knee and you're like, well, I should probably get this looked at, right? Or you're using it at the gym, or a friend comes over and they've got a shoulder problem and he's like, puts it on and it feels really good. Then they want to come in and figure out what's wrong with their shoulder and how can I use this machine? Okay. So it multiplies as opposed to keeping the people away.
Have you had a chance to take a look at the PRS library that we have for protocols? Have you been on there, or have you referenced that at all?
Yeah, every day, because I'll have a patient ask me a question. I just had one today. She's going to have surgery on her knee. She's got a completely torn ACL. We're working with her now to make sure she's nice and strong before she gets in on September 27th. She's got a PRS, and she asked me today, I'm getting nervous about the surgery. And I said, well, take it easy. We'll as you get closer to the date, I'll help you with some stuff. And I said, you know what, by chance, we just released the post-op protocol today. So I went to my phone, went to YouTube, forwarded her the video that Jake made. So she's already got it, and she's looking at it prior to going in for surgery.
So tell me a little bit about that. I mean, why would you, if you already know you're going into surgery, why would anybody even use the PRS or the RX for pre-surgery?
I've had a few, and the reason being is they want to go into surgery strong, right? It makes your recovery better. You go in with a if a 10 out of 10 is a strong normal knee, you want to go into the surgery a 6 or 7, and you do that through strengthening up all the muscles around the knee joint, so that when you come out of surgery, you're already ahead of the game. So it's about making the muscles that strong, that knee joint strong, increasing blood to the area to help with any repairs that can happen that are available without the ACL needing to be redone. A lot of times there's other injuries to the knee. And so now when you come out of surgery, you're kind of already up and running. And then now you have the portable unit to then apply around the dressing, trying to prevent things like atrophy because you're not, when you don't use something, you lose it.
Yeah.
So Dr. Sam, you also use this for other complicated complicated issues. One of them being sinusitis. Could you kind of go into detail how you're using this technology with what you know and like the results you've had with sinusitis?
Yeah. I like to preface it and say these are rare conditions. I'm not an expert, but they are things that people will mention in passing, mention during a visit about themselves, a friend or a family member. And it's something that we can show, that I'm showing you how versatile this therapy can be. You can treat things like sinusitis, trigeminal neuralgia, and Bell's palsy. And one of the things that we do is it's more of a manual digital type thing. What we do is we put a black pad on the base of the patient's neck while they're laying flat on their back. We put a bolster underneath the neck so it keeps that pad nice and tight. And then I put a red pad on my forearm, and we use ultrasound gel on the face. And in doing that, sinusitis is viral and bacterial type stuff. And really the only treatment for it is medications, right? And maybe decongestants, or trying to work on it on your own through over-the-counter remedies. In the past, I'm certified in acupuncture. And so I would use acupuncture on the sinus points to try and relieve sinusitis and trying to open up those sinuses. Through working with the machines and other digital stuff we've done with toes and fingers, we started working on the face. And you can hit those same sinus points with current through your digital finger. And it's way more effective. If you think about an imaginary line going from the base of the neck to your finger, you're going through each of the points on the face, and that type of reaction opens up the sinuses much better than acupuncture can. So we can do between 10 and 20 minute treatments, both sides of the face. And it's instant. I mean, people stand up and they start to drain or have more range of motion with their breathing, less congested, less facial pain. It's very effective.
So you're essentially transferring current from you to the patient. So you're actually accepting some of that current first.
Correct. It's going through the base of the neck and the patient through to my finger.
Wow. What's the intensity, like the output power levels of that?
It's really to tolerance. So we start really low. There are certain parts of the face that are really sensitive, like the forehead. And so, we hit the sinus points starting in the low, probably like a 2 or 3 output power. And then as you progress and move through it, just like you do with the other therapies in the protocols, right? You're turning the machine up to where they can tolerate it. They get used to it. It's like doing like 4 or 5 sets of an anterior delt raise with the RX 100, right? You turn it up after a minute or 2.
Wow. This one's fascinating. Is this also something that you can use for the PRS? I know not as a treatment device, but can it potentially do the same thing?
Yep, it could do the same thing. Obviously, as you addressed it in the intro. It's half the power, half the speed. But yeah, you can definitely have pads on the face over the sinuses that, again, to complement what we're doing in the office to speed this process up. And you talk about like, well, when they go away, well, no, they're going to refer more people because we can get people better, quicker, faster.
Wow.
Interesting.
So
Yeah,
when you're, I'm sorry, Matt. One more question on the trigeminal neuralgia. So is that a completely different modality that you're using, or you're essentially doing the same thing with this and Bell's palsy?
All three conditions are the same exact thing, right? So, especially with the Bell's palsy, when you think about it, it's a virus that's set up, and it's either a herpes zoster or a shingle, and there's facial drooping, right? So if you can tighten up the muscles, increase muscle tone, otherwise you're told to just wait and see, it'll go away on its own, right? So you can tighten up those muscles of the face doing that same process. It's a little bit different. Instead of just hitting the sinuses, you're actually hitting all the facial muscles. But it's very effective. It's just like atrophy anywhere else in your body.
And still with that transfer, like on red pad on you and then the black pad on the back of your neck.
Same transfer, black pad at the base of the neck, all three conditions, red pad on the practitioner's forearm, and using ultrasound gel in the face or any other type of medium.
Jake or Dr. Sam, could you kind of explain to me, the layman's term of what those three conditions are? So for myself and anybody else that aren't familiar with that, what is that? Those three conditions? Well,
sinusitis is a viral bacterial infection in the sinuses, in the sinus cavities. Trigeminal neuralgia is facial burning and pain. Not really sure what it's about. Sometimes it's related to an artery that's inflamed. And again, the treatment on that is medications and ultimately surgery to try and release that area. But it's really just a wait for it to go away. And then the Bell's palsy, it's a virus again that's set up in the face, and you have facial drooping. Looks like you've had a stroke on one side of the body. And if you can apply current and tighten up the muscles to something like the Bell's palsy, speeds up that recovery so you don't have that same facial drooping and atrophy.
I have a question for you, Sam, in regards to this. Kim was asking, do you do this treatment for Bell's palsy at your Taylor Street office?
Yep. Every office has the capability of doing it if they have the ARPneuro RX100.
Another question. You kind of got a lot of people sparked on the sinusitis and this current transfer. Jennifer Ingreo asks, is the Sinusitis Protocol safe for individuals who have had endoscopic sinus surgery in the past?
Yeah, it's no problem. It's no different than any other joint or body part that we're working on, right? Like if somebody has metal in their body because of a break, we can work over metal. It's like we've talked about in your intro, it's harmonious with the body. There's really only three conditions that we can't work on, and that's somebody that's pregnant, stroke in the past year, and any type of internal electric stim unit or pacemaker.
Awesome. Another question. I've had Bell's palsy surgery and am doing facial PT and medical Botox and trying to speed up the process. Will this help now?
Absolutely. Helps right away.
Awesome.
You will see a change on day one.
Wow. That's pretty compelling.
Listening to this, it's amazing. I mean, I still look at this and go, it's an art. I mean, this ARPneuro RX, and it's literally an art form. You guys are artists, and I applaud you for, taking this unbelievable technology and being able to apply it in all these different conditions. That's kind of what I've learned in my short time at ARPneuro. It is amazing to see how this can help, and without the traditional medicines and the pharmaceuticals and all the other things. So, from your perspective, Dr. Sam, I mean, it is a pivot 100% from what you probably studied in college and what you came out and how you're doing it now. Love to get your take on that and how it's, changed maybe your perception of your practice.
Yeah, I mean, everything's moved since I've incorporated this therapy. Everything's moved into active-based therapy. I've gotten away from the passive stuff, unfortunately, that we kind of learn in school, even though they've taught some active stuff back then, but you're talking over 20 years ago. It's a way to I can scan an area, find out where we've got atrophy or scar tissue or muscle groups that are hypertonic, hypotonic. I can turn on muscle groups quicker than you can ever get on your own. Even if I sent them home with home exercises, they're not going to do it. And then the versatility of moving into things like the face or turf toe, these little areas where you can do a manual therapy with the current going through my fingers, work on fingers. We have the access to foot and hand baths for neuropathy. These are all things that I wasn't able to technically treat just with traditional chiropractic.
You mentioned turf toe. I'd love to hear, as a typical, weekend warrior sitting there, armchair quarterback, whatever you want to call me, watching NFL football, you hear that term turf toe. Could you explain what that really means and how painful that is for a player or person that has it, and how you can help overcome that with the ARPneuro?
Yeah, you basically from running, soccer players, football players, unsupportive shoes, and then the ligament on the bottom of the first toe gets stretched out and could go as far as tearing it. So again, getting back to what we can do with the face, applying that same treatment method, right? I'm putting a pad on a black pad on the patient's leg and a red pad on my forearm, and I'm using ultrasound gel or water to work on that toe. Same thing we can do with a finger, just an area that is hard to address. There's really, as far as like treatment goes, it's trying to stay off of it or splint it, and we can apply current to it to help speed up the healing through blood flow and the strength of the muscle groups around it to take pressure off of where the site of the pain is.
Wow.
Do you recommend the foot bath for that turf toe, or is it more of a hands-on approach that you take?
I would do both.
Okay.
I would apply the digital therapy that we are talking about now for 10, 15 minutes, and then I would also apply a foot bath on them for the 10, 15 minute mark.
Okay. I'd love to get your opinion on the foot bath and some of the things and conditions that you treat with the foot bath, and maybe some success stories or some great outcomes that you've seen with that.
The foot bath I'll use with ankle sprains, plantar fasciitis, the turf toe, neuropathy, and it might be a hybrid. A lot of times when these patients come in with the ankle sprains and their foot is swollen, they're on crutches, they're on a splint. I'll do the active movements, get them moving dorsiflexion, plantar flexion while they're seated, non-weight bearing, semi-weight bearing. And then I'll transfer them over to a foot bath right after. So I'll do a hybrid.
So Dr. Sam, your place is like a laboratory. And what I mean by that is you have so many people coming in and out. You're spending a lot of time, obviously, in the office, but you also, you've been an out of the box thinker in this. Can you explain to everyone how this started with your protocols and how you grew to other protocols just based on you trying new things? Because I know you do a lot of different modalities and probably created some of your own in the process of how often you've treated.
Well, it's kind of like what Matt said. It's an art, right? So you have a base that you start with, and then you work out from there. You figure out like if something is kind of plateauing or not getting better, and you can kind of switch gears and figure something else out. Not everybody's a cookie cutter. So at one point somebody that has neuropathy, hey, we're just going to do a foot bath with you. Somebody's got the ankle sprain. I think we need to do a hybrid because you've got ankle swelling. We need to move some of that inflammation out of the foot through our foot bath in the direction of our current, right? Our current starts in a black pad looking for a red. So we can use that to our advantage, even in the portable PRS. So if we need to move lactic acid out of the leg or we need to move edema, we start with black low, red high.
And that's actually interesting. I want to segue to that because we do have a question that came up by John. Could you explain what's involved in the foot bath?
Yeah, I can explain, as well as you can also look at your videos on YouTube, right? So we have a black pad on the bottom of the foot in water. We use warm water. The water's up just above the malleolus. And then we put a red pad on the opposite side of the body, lower back or quad. And that is increasing blood to the foot. And then the direction of the current is now pumping that blood and lactic acid out of the foot. It also works on strengthening. So if you've got a black pad on the bottom of your foot contracting at 500 pulses per second, and you've got something like a plantar fasciitis that everything's been stretched out, the little intrinsic and extrinsic muscles of the foot are weak and atrophied, you're going to see that foot tighten up and the toes and arch will shrink up and curl. So you can work on strengthening in the foot with a foot bath, as well as working on fluid.
Oh, awesome.
Wow,
pretty simple setup. And I don't want to be presumptuous, but I think this is Dr. Neal. He just wanted to say he loves your confidence. So I thought I'd address that real quick. You haven't seen him in the office treating 6 people at once. That is crazy.
It's amazing. It is absolutely amazing. So, unbelievable. It sounds like you have pretty much taken advantage of this technology over the 13 years and have been able to really treat just about every one of those conditions that we've seen on the slide. Because I am always amazed. What I have found as we've been talking and bringing folks like yourself on to these Q&As is, they tend to go and they become very good and specific in one condition, which blows up their practice because now they become the expert on, concussions or, it sounds like you're kind of the jack of all trades and you've been able to, treat so many different conditions. It's amazing. So
you're able to treat more conditions, right? Because typically you go to a chiropractor for neck and lower back pain, and now you open yourself up to being able to strengthen up a knee with somebody that has knee arthritis. You strengthen up all the muscles around that knee joint. I can't do that in here without the RX100. I'm able to treat things like neuropathy or concussion, these facial injuries or symptoms. You're opening up to way more opportunities to see patients and help them.
So if you were, let's say there's an area of the country or an area of, that is, does not have ARPneuro in a clinic, and there's multiple chiropractors or offices in that area, what would you say to any one of those clinics to say this could be a game changer in, how you treat patients?
Well, I kind of touched on that earlier, right? There's only half a dozen schools, 6 or 8 chiropractic schools out there, right? Same thing with PT. We're all going to do the same thing in your art, right? If you can incorporate something like this, it sets you apart from everybody else, no matter if it's chiropractic or PT or in a gym setting. You've got a machine that can diagnose, can strengthen and increase blood flow 10 times more than you could ever get on your own in an office setting or as a patient. So it does separate yourself, and people will travel for it because, and even in town here where I've been in this office now a year and a half, there's at least 6 or 8 other chiropractors, but I'm the only one doing this. So they're going to come here, right? The other 6 or 8 are doing the same thing. The only thing that sets them apart from each other is their bedside manner. Do they like them? Right. But this therapy is something different. And it's versatile. I can treat so many different things.
Speaking of that, Dr. Sam, it's obviously very vast on what it can do. If you had to pick as far as the most successful, any patient coming in and you're going to get results using this technology, what would you choose out of all of them?
Shoulder.
Interesting. Why is that?
Maybe because I've had the injuries and I can talk to you about it. I've had the dislocations and I've had the tendonitis and I've been through the therapy and continue to use things like a PRS at home. I don't know. It's my favorite joint. If you come in with a shoulder in this office and you don't know what we're going to do, you're just like, hey, just help me. You're on the ARP and you'll be walking out of here better than you came in. Range of motion, pain, everything.
So that's interesting. That's the biggest thing I see from shoulder is, especially with frozen shoulder, we see range of motion immediately. Yeah, that's very compelling by itself. So yeah, shoulders, not surprising, but I was just curious since you see hundreds of patients a week.
And, in the shoulder. So, we, like I talked about before, right? I'm going to scan it. We're going to find areas that need help, put you through movements, anterior, lateral delt raises, internal external rotation exercises, and try to apply a PRS for them to take home. and then really explaining to them if you have tears involved, you need blood to this area to help those things resorb back together again. If we can get that through 6 to 8 hours overnight on a portable, some hours during the day to help facilitate these muscle groups that we found that are atrophied or weak. And that's how you'll see this thing recover quicker and faster.
Probably one more question from me, but I am curious. I know you play hockey. I know you are a phenomenal hockey player. I know you still play hockey. Is this the way you recruit? You go on the ice and you give a nice body check to your buddy and you bring him into the office and have him try this technology?
That has happened, but not on purpose. But yeah, it's no different than word of mouth, right? Every skate that I'm on, I'll have multiple players that come in, and again, they're not all coming from this area. You get together at the rink, you come from distances, and they're going to travel to see me because of the feedback they get in the locker room and the fact that I'm doing something different than everyone else out there.
Yeah,
wow.
It's interesting. We just were on a call yesterday with one of the NHL teams, and they're going to incorporate the RX and the PRS into their locker room. And one of the interesting things was they had a player traded from one team to their facility a few years ago, and that's how they discovered the RX, because this particular player brought it with them. Mm-hmm. And that's so now it's going to be incorporated in their locker room, as we find with all the professional teams. So it's nice to see that you're helping support some of the weekend warriors. From that perspective, pickle's such a big game. You've got to be seeing injuries coming from that new sport.
It's more golf, but yeah, pickle it's starting to get there.
Okay. When you say golf, give us some examples of some of the patients that you've been able to treat with golfer issues.
It's all elbow and shoulder. Mm-hmm. They're coming in right now because in Chicago we're in the middle of the season, right? It's only 3 to 4 months, so they don't do anything all winter, and then all of a sudden it's spring and we start to go to the range, and you're hitting balls off the turf and the concrete and the vibrations going up your arm, and then next you know it's the season and they're trying to squeeze it all in. So it's all shoulder and elbow, and I mean I get it all the time. I'm unable to play. I got to get back playing. The season's almost over. And we get them playing again.
That's unbelievable. You did mention the chiropractors and the schools, and it is amazing. We're amazed at how aggressive these colleges, because there's only, not, as you mentioned, not too many chiropractic schools around the country, how they're incorporating this technology to teach the new doctors coming in. I'd love to get your take on that, and why do you think that is?
Well, I think there's some schools that are traditional and they're not going to touch it. And then you have other schools that think more out of the box, like Logan or Kaiser. And, they want to be ahead of the wave. And I think a lot of the, it's also based on insurance reimbursement that, people in these companies want to pay for active therapies. And this is an opportunity for older chiropractors that are more traditional and just do stim and heat to change their practice and become this active therapy out there that insurance will pay for, and their patients get better. So I think that's the wave, is that the chiropractic schools are going to start moving into this active therapy, especially, now that we've started to have some conversations in clinics with Logan and Kaiser.
That's great.
This question, I think, comes in probably for you more so, Matt, but I know we do have some players from there. We don't have any New York teams locked in yet, do we?
Well, I think very similar to what Dr. Sam mentioned, it's a secret. It's like, as a Chicago native and a huge Bears, Blackhawks, Cubs fans, we almost want to keep that quiet from any of those New York teams. So
come on.
No, I think you'll find that in just about most locker rooms. I think it's just like, one of the things that I can assure you, it's about how they've integrated it into their practice, because it is such an art form. What we have found is, with Jake and some of our team, we're constantly kind of having those conversations with all these professional teams to make sure they take full advantage of the technology, whether it's for elbows or knees or concussions. And we're starting to get some huge success with these pro athletes that are buying the PRS for themselves, even though it's available now to them for, if they're on IR, they're now starting to, get that technology, whether it's the RX or the PRS. But a lot of these pro athletes, like you said, they want this technology for themselves, and they're on our website on a regular basis ordering their own PRS. So,
a good example of that was I had a patient come in 4 years ago. He was a New Jersey Devil. And he came in because when he's with the Devils, 4 other players had an RX 100 with them in the locker rooms and on the planes and in the hotels. And his hip was bothering him. And they're like, well, slap it on, front and back of the hip. And he's like, we would fly from, New York to LA, and I'd have this thing on for 4 hours. My hip felt better. I don't even know what I was doing. Right. So once he got into the off season, he lived in the Chicagoland area, and he started coming in as a patient. He's like, I got to find out where we need to be, what I need to do. We spent the whole summer together, and then eventually he bought a machine from another player that retired. So it's kind of the reaction is you get to a team, and then players start to kind of put it on each other, and then next thing you know, they're looking for it.
There you go. Come on, Yankees, get on board.
Yeah, it's interesting. I had to go to our website because I'm not that familiar with the names, but on pro athletes using ARP on our website, if you haven't, you've got to take a look at Tim Thomas. He was a goalie that had, I believe it was hip surgery, and used the ARP technology, and it was part of his acceptance speech of a very coveted award for goalies in the NHL. So, all great stuff. Well, I know you've probably got patients in the waiting room, Dr. Sam, without question. They're lined up. Thank you so much for your time. Really appreciate it. So glad we got you on, and very, very informative. Jake, I don't know if there's anything else, questions or anything you want to add.
There were other questions that came up where we apologize we haven't gotten to them. You can always reach out to us at info@arpneuro.com, of course, and check us out on the next Q&A, and you can always ask us there as well. But thank you for everyone's participation and questions, especially Dr. Sam Battaglia. It's good to see you. I enjoyed seeing you in person again, and you're a rock star.
Awesome. Thanks so much, everybody. Have a great afternoon.
Take care.